Hey, future RNs. If you're studying for the NCLEX, you know there are some topics that are pretty much guaranteed to show up. And guess what? Hypertension is right at the top of that list. That's why today we're doing a full, focused study session on everything you need to remember for test day. We're going to cover the categories, the signs and symptoms, what to do first, the must-know meds, and patient teaching. Welcome to ClearPath NCLEX. Let's get straight into the material.
So, why is hypertension such a huge deal for the NCLEX? Well, it all comes down to its nickname, the silent killer. And that's not just for drama, it's a chillingly accurate description. Most people have absolutely no symptoms while their blood pressure is dangerously high, causing serious, long-term damage to their most important organs. We're talking the heart, the brain, and the kidneys. The NCLEX needs to know that you can spot this silent threat before it's too late. And this quote right here, it really gets to the core of the problem. A patient can be walking around feeling totally fine, while inside, this ticking time bomb is building. That's exactly why the NCLEX hammers this topic so hard. They want to see that you can connect the dots, that you can identify the risks, prioritize the right actions, and empower your patient with the teaching they need to control this for life.
Okay, deep breath. This next part is pure memorization, but it is absolutely non-negotiable for the NCLEX. You have to know these official blood pressure categories. I'm going to walk you through them nice and slow, and then we'll do it again to really make sure it sticks. Trust me, you are going to see these numbers on your exam. You've got this.
All right, let's go through these numbers and pay really close attention to the word and versus or. It's a classic NCLEX trick. First up, normal. Systolic is less than 120, and diastolic is less than 80. Both numbers have to be in range, okay? Next, elevated. Systolic is 120 to 129, and the diastolic is still less than 80. Now here's where it changes. Stage 1 hypertension. Systolic is 130 to 139, or diastolic is 80 to 89. See that? Only one of the numbers needs to be high. Then we have stage 2 hypertension. Systolic is 140 or higher, or diastolic is 90 or higher. Again, just one of those numbers puts you in stage 2. And finally, the big one, the emergency, hypertensive crisis. This is a systolic over 180 or a diastolic over 120. Okay, let's run through that one more time, quick-fire style to burn it into your brain. Normal, less than 120 and less than 80. Elevated, 120 to 129 and less than 80. Stage 1, 130 to 139 or 80 to 89. Stage 2, 140 or more or 90 or more. Crisis, over 180 or over 120.
Okay, so you've got the numbers down pat. Now let's talk about what happens when you have a real patient in front of you. How do we assess them? We need to know the two main types of hypertension and the risk factors that put our patients in danger.
It's really important to know that not all hypertension is the same. You know, a whopping 90% of cases are primary or essential hypertension. This is the kind that just develops over many years without one single cause. It's usually a mix of genetics and lifestyle. But that other 10% is secondary hypertension. This is where we can really make a difference because it's secondary to another medical issue, like kidney disease. The key takeaway is if you can treat that root cause, you can often fix the hypertension.
Now pay close attention here, because this slide is a gold mine for those select all that apply questions. We can basically group these risk factors into two buckets, the ones you can't change and the ones you can. The ones you can't change, things like getting older, family history, and race. But the modifiable ones, that's where we as nurses shine with our patient teaching. We're talking about obesity, a high-sodium diet, not being active, smoking, stress, and high cholesterol. These are the lifestyle issues we need to address. I'm going to say this again because it is one of the most important things to remember. Hypertension is almost always asymptomatic. It is silent. So, if a patient does start having symptoms, that is a massive red flag. It means the disease isn't silent anymore. These late signs are things like a pounding headache, blurry vision, nosebleeds, or chest pain. If your patient mentions any of these, you need to act fast.
All right, this is where the NCLEX really tests your critical thinking. They're not just going to ask you for a definition. They're going to paint a picture. Your patient's blood pressure is dangerously high. What do you do first? Let's break down the priority actions, step by step. So you see that high number? Your first move isn't to medicate, it's to validate. Step 1, recheck the BP. Use the other arm, and please, make sure you're using the right size cuff. Step 2, assess the patient, not just the monitor. Ask him about those red flag symptoms we just talked about. Are you having a headache, vision changes, any chest pain? Step 3, position them. Get the head of the bed up. That can help lower their pressure a bit. Step 4, medicate. Now you can check for any as-needed blood pressure meds. And step 5, escalate. If that being called a provider or the rapid response team immediately, that's a life-threatening emergency.
Okay, let's switch gears and talk pharmacology. The NCLEX loves to test you on hypertension meds. But don't worry, you don't need to memorize every single drug. You just need to know the major classes, their common endings, and their most testable side effects. Let's break them down.
First up, we've got thiazide diuretics, like hydrochlorothiazide. These are often one of the first meds prescribed. They help the kidneys get rid of extra salt and water. The number one thing you need to remember is that they waste potassium, so you've got to monitor your patient for hypokalemia, which is low potassium.
Next are the ACE inhibitors. These are your pril drugs, like lisinopril. If you remember one single thing about ACE inhibitors for your exam, make it this. The classic side effect is a persistent, annoying, dry cough. And unlike the diuretics, they cause the body to hold on to potassium, so you're watching for hyperkalemia instead. So, what happens if your patient just can't stand that nagging ACE inhibitor cough? Well, that's where ARBs come into play. These are these sartan drugs, like losartan. Think of them as the alternative. They work in a similar way, but without causing that cough. Moving on to calcium channel blockers. A lot of these end in dipine, like amlodipine. These drugs relax the blood vessels, but here's the key, they also slow down the heart rate. So the most important nursing action is to check the patient's heart rate before you give it. If that heart rate is less than 60, you hold the med and call the provider.
And finally, we have beta blockers, the olol drugs like metoprolol. These are so important on the NCLEX for two big reasons. First, they can cause bronchoconstriction. You absolutely do not give beta blockers to patients with asthma or COPD. It is a major safety issue. Second, they can mask the signs of hypoglycemia in your diabetic patients, so you have to be extra careful with them.
All right, we've assessed, we've medicated. Now comes one of the most vital parts of our job, and a huge topic for the NCLEX, patient teaching. Our goal is to give our patients the tools they need to manage this chronic condition for the rest of their lives.
So what are the absolute must-know teaching points? First, diet. We're talking low sodium, less than 2 grams a day. Second, exercise. A simple 30-minute walk on most days can make a huge difference. Third, medication adherence is key. They have to take their pills every single day, even when they feel great, and they should never, ever stop them suddenly. Fourth, teach them how to check their blood pressure at home and keep a log. And finally, make sure they know when to call for help for any severe headache, vision changes, or chest pain.
Okay, that was a lot of information. So now let's put it into practice with a quick NCLEX style question to see how well it's all sinking in. I'll read the question, and then you can pause and think about your answer.
All right, ready? Here we go. A patient's blood pressure is 148/94. How should the nurse classify this finding? Go ahead and pause here for a second and think it through.
The correct answer is stage 2 hypertension. Remember our chart? Stage 2 is a systolic of 140 or higher, or a diastolic of 90 or higher. This patient's reading actually meets both criteria, but it only needed to meet one of them. Awesome job!
Let's wrap up with a quick little cheat sheet. These are the absolute must-know facts for test day. Know your blood pressure categories like the back of your hand. Know that 180/120 is a crisis, and your first move is to call the provider. Remember, ACE inhibitors, your prils, cause that dry cough. Beta blockers, the olols, are a no-go for patients with asthma. And for teaching, just hammer home that low-sodium diet and taking meds every single day.
And that's it. You just did a deep dive into one of the most high-yield topics on the entire NCLEX. You covered the categories, the priority actions, the meds, and the teaching. Take a deep breath. You are so ready for these questions. You are going to nail this.
Thanks so much for studying with me here at ClearPath NCLEX. If you found this review helpful, please hit that like button and subscribe for more high-yield NCLEX content just like this. And don't forget to ring that notification bell so you won't miss our next study session. You've got this. Now go ace that exam.